Dr. Stan Strycharz. He has a doctorate in clinical psychology, a master's in theology, a master's in counseling, and he's a licensed local clinical psychologist. So without further ado, I'd like to present Dr. Stan Strycharz.
Thank you. So I am honored to be here and participate in this presentation. Today we're going to talk about mental health in a workplace. And I am sure that everyone who is with us today understand how important mental health right now is during this pandemic that we all experience. So we're going to look at how the issues of mental health change or impacted us because of COVID-19. We are going to look with greater detail at depression and anxiety. Why depression and anxiety? They're predominant mental health issues that most people will experience. We are going to look together how we together can improve our services and our understanding of mental health so we can be there for our employees, for our colleagues and people. Then I will spend a few minutes practicing with you mindfulness that is proven to be effective for a variety of mental health issues such as depression, anxiety, post-traumatic stress disorder. Why it works so well? Because it does, we learn to self-regulate emotionally. And then we're going to leave some time for questions and answers. So I would ask everyone to hold on asking questions until the presentation is done. It will roughly take, we will take 20 minutes of your time. So the first slide you are seeing how workplace is affected by mental health. We spend almost $1 trillion of dollars on mental health issues. So it is extremely costly. Interestingly enough, 67% of Americans will report experiencing some kind of mental health issues within the last year. And that number actually, because of COVID, is growing upwards. Mental health disorders and substance abuse cost U.S. employers 79 to 105 billions in indirect costs. So it is very expensive. And our awareness of our own mental health issues and our colleagues really is going to influence the quality of workplace that we create for ourselves and for others. As probably most of you noticed, coronavirus has incredible impact on our mental health. 7 out of 10 employees say that COVID created one of the most stressful time in their professional career. Interestingly enough, also until 2019, we saw steady decrease in prescription medication for anxiety, sleep, depression. And the newest data points to incredible spike in new prescription for anxiety and antidepressant and sleep medication, 37, almost 40% increase. That's huge. Most people report problem with sleep. And of course, not receiving great quality of sleep is going to affect your temper. And many people try to cope with all these changes and mental health issues. Unfortunately, not always in the most healthy way. Oftentimes by increasing alcohol consumption to decrease anxiety, or even using drugs in order to lessen the symptoms that they experience. Here, one more interesting fact that federal government has a hotline that people can call with mental health issues problem, and that mental hotline saw a spike in calls from 2019 to 2020, 1,000%. So 1,000% increase of phone calls dealing with mental health issues. So the impact of mental health because of a coronavirus is absolutely devastating. Excuse me. So here on the slide, I chose to share with you most frequent mental health disorders in the workplace, which is anxiety and depression. We have to remember that anxiety and depression are comorbid, so they're going to often be experienced together. So some people may experience more predominant anxiety, but usually there is depression part of that anxiety, or vice versa. And they may experience stronger depressive symptoms of anxiety, maybe lesser. So we see anxiety here as the most common mental health issues. It affects 25 million Americans annually. And we have to remember that anxiety is a normal response to stress. Actually, moderate anxiety helps us to improve our performance. So often before deadlines or tasks that we have to take, we may all experience some kind of increase in those anxiety symptoms, but we can channel them by being more productive and effective. However, when anxiety is chronic and affects quality of our lives, sleep, then becomes a problem. Similarly with depression. So depressive symptoms actually are more common with women than with men. Interestingly enough, those of us who are blessed and fortunate enough to be parents need to know that most women will experience postpartum depression. So it is very normal and common condition, human condition, to experience sadness, depression. And again, the symptoms with most of us are not going to be chronic enough to interfere with our work, sleep. However, when not attended, can create serious problems in our functioning. So in next slide, I want to help you to really see how you may recognize depression in the workplace, either in your own functioning or functioning of others. What I would like to remind everyone, it is not our job to diagnose our colleagues or employees with depression. Leave that to professional people. However, we all can be more attentive and learn to be less judgmental, recognizing that people around us may suffer, and help understanding those issues will help us to respond in a more proactive and healthy way. So you may see that one of your employee is suddenly withdrawing and isolate himself or herself. Yet the same employee a month ago was functioning extremely well, always on time, always fulfilling his deadlines and so on at work. This may simply be symptoms of depression. Someone who may have progressively worse difficulty in concentrating, and you might find that person to be kind of scattered or absent-minded. Again, this may be a symptom of depression. Someone who is going to be tardy, come late to work, perhaps that person may have trouble sleeping. So what is really important to know that COVID-19 coronavirus is going to activate in most people fight or flight response. I mean, we see constant danger around us. We know that people get infected with COVID. Some die, and the number obviously is approaching almost 200,000 people in United States alone. So our body is going to be on constant alert. So we all right now are going to have difficulty sleeping. Interesting fact, probably most of you traveling and sleeping in other places, hotels, will may remember that you don't sleep as well as in your own bed, right? It is a fact that majority of people will not experience the same quality of sleep and rest when we outside of our own home, our own environment, because our body is on alert. We are in a new situation, new environment, and that extra vigilance is a result of our limbic system, our part of brain that is keeping us safe for thousands of years. So other symptoms that you may see in others or yourself is low motivation, sense of detachment from others. And again, that will be a result of increased fatigue, energy loss, and so on. So this slide is very important because as we were speaking together about this presentation, my hope was that as a result, we destigmatize mental health issues. Often we all can use mental illness as a very negative label, and I think we are all aware of that. And yet, as you look at this slide, mental health and mental illness are at the opposite side of the spectrum. So all of us who are mentally healthy and we report incredible well-being and satisfaction will experience occasional stress or mild distress. Some of us dealing with chronic stress or struggles in life may experience mild to moderate distress. And it is important to know that once you see more and more symptoms and you know that something is not right with you, it is important not to wait until symptoms of your mental health issues become severe and chronic. And here is where mental illness comes. You know, in my practice, truly, someone who will experience schizophrenia I will diagnose that person with mental illness. But most people I work with, actually very few people will continuously experience mental illness. They may met criteria for very specific time, but then as we treat their symptoms, the symptoms will disappear and they're going to go back to either moderate or mild distress and then move back to healthy and productive functioning. So again, all of us can be on the spectrum, can go from healthy functioning to mild to moderate to severe and chronic. So how do you create or how one create a mentally healthy and friendly workplace environment? I think one of the most important aspect of that is confidentiality. You know, when culture in our company, when we all respect confidentiality and we are sensitive to others' health issues, physical health, mental health, we're going to model and we create that place where we safeguard employee confidentiality. Training like this is very important. So we are aware that mental health is very important. I mean, for most of us who are still working, we spend a huge amount of time daily at work. So if the work environment is not healthy, it's going to impact our home environment and vice versa. So creating workplace environment that is healthy, and we are sensitive to mental health issues and wellness, is going to have incredible impact on the quality of employees and people we have in our companies. So another aspect of creating this healthy work balance is flexible schedule. So interestingly enough, most of my colleagues who are physicians, when they apply for a new work, they will gladly trade their increased salary for more flexible schedule. And that flexibility is so important in addressing creating healthy workplace environment. Another also important fact is, sometimes people need to seek treatment. Really make sure that you are able to, as an employer, that you are cognizant of that people need to care for their mental health wellness. And the result of that is going to be increased benefit for our company in so many ways. So what employers can do. I think stigma is one of the most probably challenging aspect of creating a healthy workplace environment. And I think we all have to do a lot to combat. And I believe that coronavirus is calling on all of us to take mental health issues and mental health wellness seriously. So next slide, because I'm watching my time. What employees can do. I think self-care is so important, and that self-care includes regular exercise. Exercise actually, according to many studies, in long term is more effective than any anti-anxiety or antidepressant medication in most cases. And it's important, for example, as a psychologist, there are plenty of studies show that if the psychologist that is treating a person is healthy and they practice healthy self-care, that really will in turn promote greater recovery for the people they care for. So you as you can truly be in charge of that and maintaining healthy exercise, sleep, eating. Another aspect, social connection, which right now I think for all of us is a little bit more challenging. That connection to others, that support that we create with other people is incredible buffer in staying mentally and physically healthy. Benefits of mentally healthy workplace is just absolutely enormous. It is going to impact self-worth and self-esteem of people that work beside you. It's going to impact your revenue. It's going to increase productivity, retention, and definitely when people care about each other, you are creating incredible teamwork and you also people know that workplace is an environment where they can express their own struggle and needs. It's going to translate in increased retention, increased engagement, and so on. So I thought that I will practice with you for a few minutes mindfulness meditation. And studies show that mindfulness meditation is incredibly helpful. For example, I usually do once a year my annual physical exam. Thank God I'm staying healthy enough. And every time I go, the nurse of my doctor will first check my blood pressure. And like most of us, my blood pressure will be higher when I see a white coat. And she would say to me, Dr. Stan, why don't I leave you for 2 minutes alone and I will take your blood pressure again. And of course, she knows I will practice my mindfulness and my blood pressure literally will drop from 140 to 120 instantly in 2 minutes. So it reduces inflammation, increases resilience, is excellent for anxiety, depression, post-traumatic stress disorders. And if you want to really read more about it, you may read work of Jan Kabat-Zinn. That is, he's an American pioneer on effectiveness of mindfulness and impact on our health. And so let's now, wherever you are, try to sit comfortably and just do your part. This is not as hard as people think it is. So I will give you like a Ferrari version of mindfulness so we can all learn very quickly. So just close your eyes and we're going to utilize your senses to disengage with everything that is around us. And the result will be truly decreased anxiety and just sense of presence that we all should experience daily in a greater way. So close your eyes, please. And then I want all of you to take a deep breath in and deeper out. And all I want you to do is hear your breath. Try not to think, not to feel, just hear. And if your mind wanders, it's okay. We're only humans. So just go back and hear your breath. Hearing is remarkable because it's one of the first things that we, in a womb of our mom, we first sense that is awakened, and the last one to go when we are ready to leave this world. So hear the sound of your breath. And your breath should be deep. I want your belly to breathe with you. Beautiful job. And now feel your breath. Notice how cool is the air as you inhale, and notice how warm is the air as you exhale. So you can use your mouth or your nostrils as a temperature gauge. Take a deep breath in. Notice coolness. Breath out. Warmth. In and out. One more time. In and out. Beautiful job. And now feel the back of your head. Even with your eyes closed, you can still sense the back of your head as you breathe in and out. Breathe in and out. Feel your upper back. Focus on your upper back as you breathe in and out. Focus on your lower back. Feel your lower back as you breathe in and you breathe out. Breathe in and out. And now let go of everything from your mind. So maybe your next meeting that you think you're ready about, or day, or just release all of it. The way I do it is try to visualize that you could load all your struggles, issues, problems on a big cargo plane and watch that plane taking off. And while you're standing free of all stressors, and you just watch that plane disappearing in the horizon with all your stressors while you are free. Not even one worry. For those of us who believe in higher power, you may want to give all your struggles to higher power. Here it is. Take it. I need a break. Just watch your stress level going down as you breathe in and out. Breathe in and out. And now empty and relax your neck. Feel your neck. Focus on your neck. As you breathe in and out. Empty and relax your upper back. Feel it. Focus on it. Empty and relax your lower back. Feel it. Your thighs. Maybe tense your thighs up a little bit and release. Let go. Tense again and release. To help you relax even more. Empty and relax your knees, your lower legs, your feet that brought you to this place in your life. And kind of wiggle your toes against your shoes or your floor and bring that sensation upwards. Let it travel to your lower legs, feel it. Your knees, upper legs, your thighs, lower back, upper back, your neck, your head, your mind, your heart, your arms, and your hands as you breathe in and you breathe out. Again, as you breathe in and even deeper out. And now notice your mind and your heart. Don't judge. Just kind of as if you were observing from outside your body, your mental processes. And if there's still anxiety or stress, just embrace. Notice, because it's asking for you to do something about it. And with gratefulness in your heart, think of different people who are so important in your life. Acknowledge them. And as you slowly, slowly open your eyes, take your time, be grateful for the most important gift, which is gift of your life, who you are and who you are becoming. Okay, I think hopefully you are all a little bit more relaxed. And I don't know, Michelle and Bethany, how we handling
We're almost out of time, but I have a couple of quick questions. Has COVID affected your practice, Dr. Stan?
Absolutely. So I see, so people who already struggle with mental health issues, those struggles became more pronounced. And it's everything from simply calling everyone and reminding them, please do not come if you are sick or if you have high temperature or if you have temperature. So it's definitely affecting, and I find that I am more tired and drained.
And then finally, how can us as a community help you with your quest to get the word out so it becomes more commonplace to talk about? How can we help you?
I think that by getting this message across that all of us at any point in our lives, we're going to be affected by my mental health issues. And that to speak about those issues is incredibly important. And Michelle, as I spoke to you earlier, younger people, and I think that hope is coming our way with younger generation, because millennials and Generation Z are 62% of them report great comfort in speaking about mental health issues, whereas millennials, only 32% are willing to be open about their mental health struggles. So if we can just follow our younger generation, at least in this aspect, I think that we can all create a much greater environment where we can all speak about our own common struggle, which is mental health.
Thank you so much. We have one last question. It says the anxiety-related COVID is causing some employees to be fearful about returning to work. How can we help them?
I mean, I think that so for me, for example, I will, even before Collier County imposed mandatory mask, we had them in the office, because I look at the research and I found that it was airborne disease. So making sure that we practice self-distance, that place is clean, that we remind everyone that if you are not feeling well, so for example, you be mindful that some people may call you with high temperature, and be flexible. Know that people can't really say, put that on them. You know, okay, you're not feeling well. We absolutely don't want you to come to work and infect others. So that flexibility and creating structure and safety for other people, I think it's a great way of helping.
Thank you, Dr. Stan. We're out of time, but we really appreciate you addressing this important and very timely subject. The Small Business Council meets quarterly at the Naples Chamber, and if there's any questions about that, we'd be happy to take them. Thank you for attending today.